October is the month you see lots of pink. It's raising awareness about breast cancer. And joining us today from the American Cancer Society locally, we have the Senior Development Manager, Cheryl Eddy. And thanks for joining us, Cheryl.
Thank you for having me this morning.
Okay, so we know that it's important to get a mammogram and get things checked out. And I guess that's kind of the good baseline. But people are more at risk. Some people are and some people aren't. So let's talk about breast cancer risks. And so what are the factors?
Well, there's some things you can change and some things you can't change. Some of the things we can change, obviously, are avoid alcohol, exercise, keep moving, and keep eating healthy. For exercise, it's really recommended to get 150 minutes of exercise a week. You can start slow, level up, and just really be consistent with it. And then there's other items that we can't change. Obviously, women have more of a high chance to get breast cancer than males, but males also have a chance, so that's something to keep in mind. But when you get older, so we recommend starting the mammograms between 40 and 45, get them yearly, and then after the age of 55, get them every 2 years. And then also if you have some family history, if you have a parent or a grandma or an aunt or cousins who have breast cancer, it's something you really might want to check into of getting genetic screening, just to get tested to see if you carry any sort of BRCA genes or any sort of genes. But really, early detection is really key in this.
Okay, does race and even breast tissue and that kind of thing, that's something you can't change too, but is that a risk factor?
Absolutely. There is, for dense breast tissue, there is almost over 50% of women who have breast tissue that's more dense, and that's why extreme mammograms and I shouldn't say extreme, but mammograms are very, very important because you do have a higher risk with that. And then still ethnicity and race, yeah, that plays a huge factor. African American women are more at risk to get breast cancer, so it's very important to talk to your doctor about different things that you can try to prevent to catch it early.
And what about menstruation, having your period? If someone starts younger or, menopause starting later, how can those factor in?
Yeah, absolutely. And if you have an early menstruation and you start before the age 12, you are at a higher risk because you have more hormones and more estrogen throughout your body. And then also if you have menopause after the age of 55, you are also at an increased risk. So it's a juggling act. And so the more estrogen and more menstrual years you have, the higher chances you are for breast cancer. So it's really important to be open and honest with your doctors, get those checkups, and talk about any kind of family history, any kind of when you've started menopause, when you might have started menstruating, everything the doctor really needs to know.
And isn't it possible through the research that the American Cancer Society does that we even know these risk factors now? I mean, because, some of this stuff we're like, well, how did you even find this out? But I mean, it's nice to know that there's that research and there are things that we can do or things that we need to watch, when it comes to breast cancer.
Yeah, it really does help. And it helps people to really have a good idea of maybe what your future could or could not hold and things that you can control. There's a lot of things we can't control in life, but a lot of this we can control, like keep moving, eating healthy, and really getting those checkups for early detection.
Right, yeah, that's the key, early detection and those checkups, because we're really doing pretty well with breast cancer, especially when you do catch it early, right?
Correct, yeah. The risk really goes down when you can catch it early.
All right, so raising awareness about breast cancer. Thank you, Cheryl, for coming today.
Thank you.
All right, don't go away. New Edition continues in a moment.